Known for her cutting-edge style and fearless music, Charli XCX has become one of pop music's boldest and most innovative artists. Charli has always kept fans guessing, and her appearance over the years has sparked plenty of curiosity. Has she embraced the world of plastic surgery? Or are her changing looks just the result of natural aging? As always, estimated costs of potential procedures are provided at the end of the video, so make sure to stick around. In 2012, at the age of 20, we see that Charli has full brows. When it comes to her nose, she has no dorsal convexity, but she does have some nasal tip bulbosity. She has strong upper and lower jaw structures, and when she parts her lips on repose, you can see her upper teeth. When it comes to the shape of her upper lip, there is moderate arching, and her bottom lip is significantly fuller than her upper lip. In 2013, at the age of 21, I see no change. And in 2014, at the age of 22, what we're seeing here are the natural fine hairs that Charli has at her hairline. Some women come to me because they're looking to improve the shape of their hairline. They usually want a more rounded type of appearance to their hairline. But when we do hair transplant surgery, even taking the finer hairs from the back of the head doesn't quite replicate those finest hairs at the hairline. When we use single hair grafts at the hairline surgically, the caliber of that hair is always going to be a bit fuller than the finest hairs that we naturally have there. Usually that works out just fine, but it's something that I like to share with my surgical patients as they consider this type of work. Charli has a very youthful eye area. You can see that she naturally has a higher brow position. She has a natural arch to her brows, and the start and end position of the brow is the same. It's at the same horizontal level, which is very youthful and natural. She also has a very nice supratarsal platform with the supratarsal crease, and her lateral canthal position is a bit higher compared to the medial canthus, which again is a sign of a more youthful eye area. She has a very smooth transition from the lower lid to the cheek, and the lack of wrinkles in that area signifies a more youthful periorbital region. Charli also has well-defined philtral columns as well as the Cupid's bow that is very clearly demarcated. In 2015, at the age of 23, I see no change, and that's the same through 2017. In 2018, at the age of 26, I'm seeing some signs of a potential tip rhinoplasty. The tip of her nose, to me, looks more refined. It looks narrower now. Keep in mind that the tip of the nose can be approached through either a closed rhinoplasty, where the incisions are all on the inside of the nostrils, or it could be an open rhinoplasty where there are still incisions inside the nose, but there's also an external incision right down here in the mid-columellar region. That incision, if closed properly, usually heals very nicely, and it's very difficult to tell if someone's had an open versus a closed approach. But of course, anytime you create an external incision, you don't quite know exactly how it will heal. But remember, something that helps almost all external incisions heal their best is scar gel, or using some sort of a silicone strip or silicone-based gel to help the wound heal. We have a whole video on this, and we have our own scar gel that we give to our surgical patients and that we also sell on feelconfident.com. So make sure to check it out if you're looking for a high-quality scar gel to optimize wound healing. Remember that anytime the tip of the nose is manipulated, either through a closed approach or an open approach, some of those orbicularis oris muscle fibers that attach at the base of the nose are manipulated even inadvertently, and what that can lead to is an elongated philtrum. So some people after a rhinoplasty will notice that the philtrum gets longer, and that can happen with an open or a closed approach. In 2019, at the age of 27, I'm seeing some signs of the introduction of lip filler. There is now improved balance between Charli's upper lip and her bottom lip. Her bottom lip is still the fuller lip, which is aesthetically more natural. And in 2020, at the age of 28, I'm seeing some signs of the introduction of Botox. And Charli has admitted to this in the past. I think she may have started to get neurotoxin to her forehead. I'm seeing fewer wrinkles there, as well as possibly to the glabella and to the crow's feet. Those three areas are commonly targeted when Botox is initiated. It's still controversial when someone should start getting neurotoxin in their face. Some people start in their 20s as a way to prejuvenate, where they can delay or even eliminate the appearance of those more etched in lines on the face. But of course, if you're starting younger, the risk of having some muscle atrophy build up over time is going to be higher, and that could weaken the muscles, and that could cause something like brow ptosis, where you start to get a lowering of your eyebrow because of those, say, higher levels of neurotoxin in the forehead. In 2021, at the age of 29, I see no change, and that's the same through 2023. In 2024, at the age of 32, it looks like Charli may have had a lateral brow lift, sometimes referred to as the cat eye lift. The thing is that Charli has always had a higher brow position, but I also read that she may have been using some taping techniques to temporarily lift the lateral portion of the brow for various appearances. But now we're seeing the appearance of that lateral brow being in a more lifted position more regularly for Charli. And even the lateral canthus of the eye appears to be at a higher position than the medial canthus. And with lifting the lateral brow, it's possible to also lift the lateral portion of the eye itself. And I'm seeing an increased distance from the tail of her brow to where the temporal hairline starts, also suggesting a potential surgical temporal or lateral brow lift. And when we compare back to 2012, we can really see the significant change in position of that lateral brow. Some people get the appearance of a lifted brow just by contouring the actual brow hair. And there's a filter I saw recently on TikTok where people were doing just that, based on how the filter was showing them where they should shave off an area, and then the brow looked a bit more lifted and it had a different shape to it. But in Charli's case, she still has an arch there. It's just that the entire arch and the tail of the brow are at a higher position, and the eye itself seems swept. So I think that this was more likely to be a surgical change rather than just some recontouring of the brow itself. It looks to me like the lips are a bit more projected, and that's one of the effects that filler has. And while lip filler can improve lip hydration, it also anteriorly projects the lips, and some people end up wanting to dissolve their lip filler, and there's been a movement in Hollywood and elsewhere for people to actually go for lip filler dissolving. And dissolving lip filler has its own nuances. For example, when you use Hylenex, especially at high concentrations, you can potentially start to thin out the natural tissues. So it's important to use lower concentrations of Hylenex that's more dilute so that you don't thin out your natural tissue, but at the same time are able to target the HA filler that's in there. And keep in mind that filler can disperse into other areas. Like if you've injected it into the red lip, sometimes it can end up going above the vermilion border into the actual cutaneous lip. So to dissolve it properly, it's best, in my opinion, to use a cannula approach where you're able to extend into those areas instead of just a small area that you're targeting with a needle one at a time. The cannula gives you the ability to disperse the diluted Hylenex best. And while lip filler may still be a good solution for some people, there definitely is a movement away from lip filler these days. But I think the pendulum is probably swinging a bit too far, and many will figure out that as long as you use smaller quantities that are more strategically placed into the appropriate portions of the lips, you can still get a nice result without overdoing it and making it look unnatural. And I think Charli's lip filler is not overly exaggerated. And the total cost of these potential procedures is about $58,000. What do you think about Charli XCX's transformation? Are her looks all natural, or has she had a little bit of help from plastic surgery over the years? Let me know what you think and tell me who you think I should cover next in the comments below. And if you enjoy this type of content, and if you feel that you learned something new, please subscribe to this channel. Thank you so much for following along.